Dr. Christian Büttner, I'm really excited to speak with you about hyperthermia today.
Yeah.
And there is many aspects, and some of them are quite technical, but there is a huge element in hyperthermia which comes from the psychological department. And I thought it's really nice to go first into the whole psychological part, and then we talk about the technical way of using it.
Yeah.
Can you give us some insights why it is such an emotional tool in your arsenal of cancer treatments?
Yeah. Well, most people know that whole body hyperthermia has a big effect on the immune system. It's boosting the immune system. It's a beautiful tool to detoxify the body, and it's even able to fight cancer cells with this device. But what most people have no idea about is that you also have quite a big emotional charge and effect of the device. And we are trying to work with this part also. So to start with it, before people go into hyperthermia, I normally tell them it's like climbing up a high mountain. So it takes a lot of work to get up there. You have to sweat a lot. The pulse goes up, and it's really hard work. That's one part of the training. And like climbing up a mountain, sometimes you ask yourself, why am I doing that? And you really get into emotions because you think you're just a fool to try to do it. But once you have reached the top, you know what it's for. So you have a beautiful view, and you are relaxed, and you are very happy. You are even proud of yourself, and it has a effect on the body and on the mind.
Yeah, I think it's a very important part that we overcome our mental limitations by achieving such things.
Absolutely. That's the emotional and mental part. Most patients, when they go into the dome, have fear. And it's absolutely understandable because they haven't had fever for many, many years. So to go into a device that has such a power, it's difficult, and people are afraid what might come up. Yeah. And for many patients, emotions come up while they are in that device. Because not only the body is heated, but also the soul reacts on the device.
Yeah.
So
many people say that cancer is a little bit like a knot, like a tumor. It's a concentration of cells, and with the heat, it actually dissolves that, and bit by bit, the emotions which are stored in that are also released.
We are very much used to put our emotions down. When fear comes up, we say, oh, don't go there. When anger comes up, don't experience it. We definitely don't want to go there. And even if great happiness comes up, we try to limit ourselves, because what might the other people think when we get into big emotional turmoil or happening. So we are used to just live part of our emotions, and many emotions, especially the difficult ones like fear, anger, and frustration and hopelessness, they are deep down in the body. We say under the carpet. We keep emotions under the carpet. Yeah. And in a training situation like in whole body hyperthermia, these emotions tend to come up again. And if they show up, we try to help the patients to experience emotions are not good or bad, they are part of our lives. And we have to learn to work with the emotions in a good way.
So how does it happen when a client has the whole body hyperthermia? Is it during the treatment, or is it after the treatment, or how do you experience those emotions come up?
It's normally during the time when the body is heated up, because then everything is loosened and the emotions come up, And the nurse who stays the whole time with the patient is the first one to work with that. And she helps the patient to be quiet and to be in a good mood. And if that is not enough, the nurses call one of the doctors, and we are very well trained to deal with emotional stress and difficulties. Mm-hmm. So right during whole body hyperthermia, we work with the patients, and afterwards we do that in a more profound and deeper way.
Yeah, because while you are in there and you have fever, it's like a half delirious state, so you don't actually resolve anything there.
Oh, it's absolutely possible to resolve many things. So some patients really go into tears, and they want to get out of there, and they think it's very difficult. And if you help them just a little bit, they can overcome that in a minute. So it can be very fast to solve very deep problems. Some people experience things from their childhood. They come up and they see themselves as a little girl who was treated bad by a teacher or a parent or something like that. And if you help them to overcome that, it's such a great release, and that's also part of the training.
So that's something we'll talk about in a moment, what that overcoming means, because I realize that you have a very special way of looking at those things, which I really like. Now, when someone has the hyperthermia, it's a slow motion process. It's not a very fast. It takes quite a long time. Yeah. Could you describe that?
It takes about 1 hour, sometimes 1.5 hours, sometimes 2 hours to go from 36.5 or 37 degrees. I don't know exactly. We have to look it up what that means in Fahrenheit. But and then you go up to 39.5 or 40 degrees, and that takes about 1 to 2 hours. With people with a good immune system, it goes faster. With people who have had lots of chemotherapy, it takes a longer time, because the body, if it's very poisoned, has to get used to heating up again. Okay. For many years, patients have not had that training because they didn't have infections, they didn't have high fever. And in case they get high fever, normally we are used to suppress that. So the body doesn't have the training to overcome colds and infections with fever. So the body has to learn that again. And this device is part of a training program to give the body the opportunity to create fever itself.
That means if you have a client, in the beginning they had the first treatment, it might take them a long time and they don't get up as high. And then if they repeat the treatment, like we saw with Lisa, she's going in and instantly the body starts to react and she develops fever a lot faster. So it's really like a training.
It's a training program. And in the beginning it takes a little longer, and you have to get used to the surrounding, you have to get used to the feeling of having fever. In the very beginning, when the heating is on, the body temperature even goes down, because the body tries to regulate and to work against the fever. And after half an hour or 1 hour, the temperature begins to rise. And then it's relatively fast that you really go up. And when we then close down the lamps, the body continues to create fever by himself. So once the body has realized it's a good thing to do that, it works together with the treatment. Okay. And then when the lamps are closed down, we try to keep the patients for another hour or even 2 in the device, just to hold the temperature on high level. Okay. But then, like when you have climbed up the mountains, if you are up, it's not difficult anymore, because the work is to get up from down.
Every patient that we filmed and interviewed over the past few weeks with the hyperthermia bed, they all describe the 38 point something, they are actually very accurate, to 39 as the critical part
Exactly.
for them to overcome, and after that they could stay and they're quite happy. And
After that, it's a piece of cake. It's relaxation part. They really enjoy. Most patients really enjoy then being in there. After 3 hours or a little more, then you have made the journey, and you can go out of the bed. You scrub the body, and then you go to sleep in order to get the fever out of the body again. Afterwards, you go into the shower, and then you get a soup. And during all of the treatment, you are getting fresh water in order to not to have too little water in the body, because you are sweating liters. So it's a very big part to detoxify the body, and this has to be recharged with good water.
And I seen you use alkaline water during that time, and energized water, so it's really...
energized water, fresh water. It's like a change of water that is done by the hyperthermia treatment.
How many liters roughly does a person excrete by sweat in that? It's quite a lot, because you see they're really soaked, the towels and everything.
I would say it's 1 to 2 liters, and that's about the amount you have to get back into the body. And we do it zip by zip, so you don't pour in a liter. That wouldn't be taken by the body.
Okay.
So the nurse sits beside the patient, and the head has to be cooled, because you want to heat up the body. And the body has to be hot, but the head is very sensitive, and the head, it's a great pleasure for the patients to have cold towels and to drink the water. So it should be as easy as possible for the patients, especially because of the emotional charges that might come up. And so we don't give medication to bring the consciousness down. Otherwise, the patient cannot work on the things that come up.
Yeah. So when they have fears come up and panics and the heat and everything, the main part would be to just help them through that.
Exactly.
And then afterwards, you would do in a consultation about the individual emotions that came up, being a little girl or seeing some problems or abuse or whatever it was. You would resolve that afterwards. It's like it's freed out of the capsule, and then you work that off.
The interesting thing is, fear, for instance, is never the problem. Something is driving the fear, and we have to look what is behind the fear. So our part is to help the patient go through the fear. If you withdraw from the fear, it will stay with you. It will bounce back on you, and it will be bigger afterwards. If you go right through, you come to the place where you can solve it, because it's always thoughts that trigger the fear. So if you have experienced something very difficult, and for instance, as a little girl, you could not resolve the problem, but now you are not a little girl anymore, you are a grown up, and now you can resolve the problem. And that will change the way you are looking at things. If you experience something, it's very important to see it has been like that, and to acknowledge it has been very difficult for me. But now, as a grown-up, I can solve that problem, and I can integrate this part that has been taken away from me, and that is separate from me. So I have to reintegrate this part of my soul in order to be whole again. So to truly heal means to be whole again. And so the emotional parts that have been difficult before have to be reintegrated into the body and into the soul.
Cool. When a patient has the treatment and it lasts for, you say, about 3 to 4 hours minimum, and some even longer?
Not more than 4 hours, but 3 hours, 4 hours, depending on how much the patient can stand.
We've experienced that most patients are not exhausted or done afterwards, but rather energized.
Yeah, some patients are really tired. They have to go to bed, they should rest, and that's it. Then the next day, most patients say, wow, I didn't feel that strong for a long time. Yeah. But some, even when they get out there, they want to do something. So they are energized and they feel it's really a relief. And it's a physical relief because of the toxins that go out. And it's an emotional relief because you can free yourself from despair if you are willing to work on yourself. Yeah. And that's a very difficult part for many patients because they are not used to do that. Yeah. And they are not told, they have not learned how to change stress into relaxation.
Okay.
And it's a beautiful tool to trigger that. It's a beautiful tool to help the patients, but you need support of a person who is familiar with these kind of processes.
Yeah, I realized that. I tried it myself without anybody, and it felt like being in a pressure cooker. And if you don't know how high you are, and it's very stressful. So you need that control element and the safety that nothing can go wrong.
Absolutely. The hyperthermia treatment as we do it is a medical treatment. Yeah. So if you want to go up to 40 degrees Celsius, you absolutely have to have a nurse and a doctor with you. We never do this treatment without a doctor in the house. So the doctor doesn't have to stay the whole time beside the patient. That's the nurse who takes care of the patient. But in case of problems or difficulties, the doctor has to be there to resolve the problems. Yeah. And the physical, the emotional, and the spiritual problems that might come up. But this device here, the Hyperthermia Dome, I'm very excited to have it here. And this is a device that you should not use in the same way we are doing it by treating cancer patients, but it's a very effective and beautiful tool to train the body to be able to create fever. Yeah. And
so you're using normally a Heckel bed, it's called?
We are using a Heckel bed. We have another one that's a von Ardenne bed. That's the two big firms that produce these kinds of devices. But this one is a low-cost device that can be used for wellness and for training the body to learn to have fever again. But if you do it at home, what is possible, you should not go too high in the temperature. You go up to 38.5, and that's a very good training program for the body. You can do that once in a week or how often you feel good with it. But you should have a second person with you that helps you during the process and that just takes care, that can open it and that can tell you to finish the session if you feel uncomfortable or too stressed.
So you use for your medical treatments, you use the Ardenne bed or the Heckel bed,
yeah.
But you train your clients with that so that when they go home that they feel comfortable to use that.
Exactly.
And we found that this device actually brings clients in the same speed, if not faster, into the fever therapy. So it can be used for medical, but it's it's kind of dangerous too, and I think it's important to speak about that.
It's very important to speak about that you don't
cook grandma.
You don't want to cook your grandma, you don't want to normally you don't want to cook your spouse. So it's very important to see it's necessary to have a helper. And well, maybe we can just show how that is constructed. So the device has two upper parts and a mattress, and then you have the little box with the heating control, and then you have to measure the temperature in the body. We will show that later on. So here you can see is the heating system. And we have two heating systems in the first upper part, and we have three more in the lower part. There are these two and there is one for the feet, and you can regulate them from 1 to 9, so 9 is the most powerful, and we experience that for the lower part you don't need that much energy. For the upper part you go to the maximum in the beginning, and then you also have the mattress that has a heating part also on which you are lying. So it's 3 different parts, and you can use them as you like and as it is necessary. So for about 1 hour or 3/4 of an hour, you put high energy on the body, and then normally we have found out that you can close everything down and the temperature still will stay stable. And so this is the way, this is the lower part, and if we could just move that a little bit. And then the upper part is just brought over the trunk, and the head is lying outside, and here is a towel that closes this part, and you can cool the head, and if it's too hot for the client, you just lift one of the parts and the hot air goes out, and within seconds you have relief. So never try to make it too hot, because it is very important that the body gets used to having fever and that you don't overdo. So we are training our patients who have used the other medical whole body device, and then they get instructions how to use this Hyperthermia dome, and I'm very excited how fast and how sensitive it works. Yeah, here you have an iPhone, and you have a rectal electrode that is put into the body, and then on this little screen you have the temperature curve, and you see where you start from. So normally it's between 36 and 37 degree, and you should not go higher than 38.5, because otherwise you may come into difficulties that have to be treated in a medical way. And this is for, and it's a very safe thing if you watch the curve, and therefore you have to have a second person who helps you in the process, because you are busy with heating up and going through the process, so you shouldn't worry because of the temperature curve, and the second person has to know how to deal with that in a safe way. In this iPhone program with a temperature curve, you have a buzzer that will ring you up when the temperature 38.5 is reached, and in that moment you can close all the heating parts off, and still the body probably will go up a little higher, and then you have to regulate the temperature by lifting the device and letting some hot air out, but don't be too afraid if it goes to 38.6 or something, but it shouldn't go much higher, because then
it's already a medical treatment.
It's a medical treatment. It's not a wellness and training program anymore.
Yeah.
So that is extremely important.
To 39.5.
We go up to 39.5, sometimes to 40, sometimes even higher. We have experienced patients with 41. If they are fine, that's no problem. But that is absolutely a thing where a doctor has to be present.
Yeah.
So never ever try to do that alone.
Okay. Very important.
Yeah, that's really important.
But
and
when we did the tests, I actually was really excited about the iPhone app, because we checked it
Yeah.
both sensors at the same time
Yeah.
with your $5,000 device, and
Yeah.
this is a $30 device.
Yeah.
And they were absolutely accurate all the way through, right from the top to the end.
Absolutely.
So it's quite exciting to have that observation.
It's very exciting to have that. You have to have an observation tool.
Without it, it's not possible.
Without it, you should never do it.
Yeah.
The other side is that this is only 50% of what you have to check. The other 50% is connected with the patient, because it's always necessary to ask the patient, how do you feel? And if the patient feels very uncomfortable and gets into panic, and you can solve that, you have to get the patient out.
Yeah.
So the other 50% is to check the feelings of the patient.
Yeah.
So we have always these two sides. One is the more technical side that is solved by a device like this. The other one is the more emotional side of the patient that also has to be checked. So if you have a treatment and you
is impatient and just wants to crank up temperature, it's not a good thing that
it's not a good idea. Then you first have to put him in there, and then you can try again, because he will see and he will experience how it feels. And normally
it's actually a great way for partners to do it first with the other. The experienced patient that comes from here, if they show it to their partner, if they show it to a friend, so that they know what it's about, and they hold the experience, and then do it vice versa, because this way it's less scary, and they don't overdo it just because of enthusiasm.
Yeah, and it's absolutely necessary for most of modern people, because we have lost the understanding of having fever. That's a very important part. In ancient times, everybody knew how powerful fever is as a tool for the body. So the old Greeks used to say, give me the power to create fever and I'll cure you every disease. So they knew how powerful this tool is for the body. And
can we talk about the effects of what it actually does? Because you said before it's immune boosting.
Yeah.
So, but there is more. There is a lot more to it.
Yeah. So one part, a very important part, is the immune boosting. And you can see it in the number of white blood cells, in the activation of the blood cells, because it's not only a question of the number, it's also a question how active the cells in the body are. If you have, let's say, policemen that are very lazy, you can have thousands of them and they don't do the work. But if you have a few hundred that are very active, they will solve every problem. So the activation of the immune system is a very big part. The second part is detoxification. We already spoke a little bit about that. It's activating the skin detoxification by sweating. And you have to drink enough water to recharge the liquid in the body. And afterwards you have to check if it's necessary to give infusions. We normally add infusions if we do whole body hyperthermia.
And you do high dose vitamin C?
High dose vitamin C, for instance. We have some more things, cocktails that help the body to recharge the loss of electrolytes and things like that. But you have to check that. And if you do it at home, you don't want to go up that high, because then you would have to recharge many more things. So if you go to 38.5, you can deal with it at home. You will have good food afterwards. You will drink enough. Some electrolytes, and that's it.
Okay.
And
so that's what we said. If somebody has, let's say, the Bioenergy C, and they can take 1 or 2 spoons into a glass of water, drink that during the treatment, which will give them the boost, and then some electrolytes afterwards, that will take care of that part in any case.
And you see, if you get used to really speak with your own body what the body needs, you will know when you are thirsty. Most people just don't experience that. They can start the day with a cup of tea or coffee, and then they don't drink anything until the evening because they just don't feel it. But you see, how is responsible for your body? It's just you, but you have to check it sometimes. So every 2 hours you should have something to drink.
Well, I realize all patients in the box, they ask for drink all the time and they get really thirsty. So that's activating the process. But
Absolutely.
when you talked about the benefits, what I realized as well, a lot of patients go up in pulse rate and breathing. So that's another way of detoxification because the blood is really pumped into all organs and extremities.
It's like a jogging program for some hours. So some patients just go up with the pulse until, let's say, 100. Then that's normally patients that are very well trained. There are other patients who go up to 140, 150. You should not go higher at home. So sometimes it's good to check the pulse to see how high is it. If it's above 140, 150, you should stop the heating up.
You can usually see that when they get a very red head.
So you have to cool the head, you should observe the patient has to tell you in which state he or she is. But like in sports, you see, you try to go to a certain limit. It's a training program. If you go to the gym and you do training, you have to have a trainer that watches you. And the trainer tries to find out how far you can go. And you have to go to a certain limit, otherwise the effect will be too little.
I realized that all your clients that we spoke with said in the beginning they couldn't reach the levels, they couldn't go that high, they couldn't stay that long. And with repeated exercise, with getting used to it, overcoming their fears, they extend and they actually enjoy it.
Exactly. We have some patients who are excited to come back. And we, even with the medical treatment, we don't just do it once. That's too little effect. It has an effect, of course, with the first treatment, but then we normally tell them, let's do it 4 or 5 times at least. And if they are living close to us, they do it once in a month. If they are coming for a 3 or 4 week treatment to us, they will do it once in a week. Some even come and do it twice in a week.
So
but that has to be checked with the...
Twice a week or once a week?
Once a week normally is enough.
Okay, but that's with your high degree fever.
Exactly.
But what about patients who go home and who use it more like a sauna to sweat?
It's
but
more...
They also use it just to get to that 38, 38.5 to sweat, but more as a user. Sauna, they could use it twice a week, or is that too exhausting?
No, you could use it twice in a week, but like in a training program, begin with little training and don't try to run a marathon when you train the first time, because the body has to get used. You have to get used to the device, so start slowly and then progress. And in the end, you can do it twice in a week, no problem. It's like going to the sauna, but it's more intensive. And so it's very exciting to have this tool. And in a sauna, of course, you also wouldn't stay 1 hour, and you certainly wouldn't stay 4 hours in a sauna. So you have to know how to use it, and then don't be afraid and just make your own experiences, and you will be an expert within a relatively short time.
I just thought there would be still a curve on there from...
Bless you.
There would be still a curve on there from a previous client, but they don't store them, which is sad, but it really shows the heat up curve as it goes up, and then holding it completely flat. And what I realized is that you turn it off, and it doesn't, the patient doesn't cool down. As long as they stay in there, they almost hold temperature just to 0.1 or 2. It slowly goes down over an hour, which is what you want.
That is so exciting, because this dome is constructed, it's relatively close to the patient. So the heat really stays with the patient. The only thing that is a little difficult is that you can move a lot. So if you lie in there for 2 hours, 3 hours, for some patients it's a little difficult to stay in the same position. So you have to get used to that. So don't start, but if you are doing it at home, you will do it for 1 hour, maybe 1.5 hours. You don't go up that high, and don't try to do it 4 hours in the beginning. It doesn't make any sense, because it's like trying to do weightlifting with 100 kilo. It
doesn't work.
No, it doesn't work, and then the body will just be exhausted, and you have a contra effect.
Yeah. And it would be quite good to have a good friend or someone who can help you if emotional things come up, to actually resolve them, speak about them, letting them go.
And if you cannot resolve it the very minute you are in the device, just write the things down the patient says.
Yeah.
So the partner who is watching over the patient should always have a piece of paper and a pencil. And when unhealthy things come up, oh, I have to die soon, everything will be very horrible, I'm going to have a lot of pain and things like that, it's very important to write that down, because that has to be solved later on. And you have to have a person, a doctor or a psychologist who is used to work with this kind of thoughts that are very unhealthy.
They can be very dangerous with the most psychologists.
Absolutely. So
I think that's where we switch over now what resolving means, because that's one of the points when you see most people, how they deal with those issues. It's certainly not the way to resolve it. It's just to intensify it and even, double it and triple it.
Yeah. It's a difficult topic, because I found out that especially working with cancer patients, it has to have a very special training. And we speak of psycho-oncology. It's not the usual psychology, because you have to know what the tricks and special problems of a cancer patient are. And most psychologists are not trained in that field. And well, you always have to see, if you go to a psychologist, you want to get help and you want to feel better after the session, not worse. So if you go to see a psychologist and 2 times in a row you feel worse after the session, you have to stop it, because it's very easy for yourself to create unhappy feelings. You don't need a psychologist to help you do that. So,
but if you would describe the process that you do in just a few words, what is the essence? What is actually the meaning of resolving? You always say it's a transforming, freeing of energy. So how would you describe that as the essence?
So the essence is that our feelings drive the immune system, but the feelings are driven by beliefs or deep thoughts. So you have to change your way of thinking, and you have to change your consciousness. And only that brings you into the position that you are the master of your feelings. Normally, patients, and not only patients, but everybody, just is underlying their emotions, and they are driven by their emotions. They can't really control the emotions.
Like a victim mentality.
You are a victim to your own emotions, and because you cannot deal in a good way with emotions, you press them down. And then they are somehow condensed in the body. And in a cancer, for instance, it's a huge amount of energy that is stored in there. And if you just cut it out, the energy is gone. So if you are able to transform it, you can free the energy that is hidden in there, and then you can use it to live a better life. So that's the basic situation. the feelings drive the immune system, and the feelings are driven by the beliefs and by the thoughts. And you can change the single thoughts. For instance, a very unhealthy thought is, I have to die because of cancer. And many patients think that as a fact, but it's not a fact. It's an option that can happen, but it doesn't have to have happened. So that's very unhealthy. And a more healthy thought is to say, I decide myself to do the things that help me to get well again. So the very minute you experience this fear and the thought, I have to die and nobody can help me, then you begin to transform this dark thought into a more happy and healthy thought. Yeah. And the healthy thought is something in the lines of, I decide myself to do whatever helps me to get well again.
It's
and
not
that can be
to an outcome, it's the decision to actually
go into action. Exactly. To go into action. The one is the passive one, the other side is the active one. Yeah. The active one means to do whatever I think is going to help me. Can be to drink a glass of water. It can be to go out for exercises. It can be to see a good friend. It can be to stop going to my usual oncologist. It can be to stop going and coming to me. So you have to make up your mind and you have to make new decisions. And the most profound way to change things is to change your whole way of thinking. Yeah. And that is the most difficult part, and we are all struggling with that every day.
Everybody is.
And it can be very exciting to do these changes, and it can be very difficult. And I always say, try to learn from children in that respect. Because children are so beautiful examples how to train in a very healthy way. Yeah. Because when they, for instance, they try to learn walking, they will fall down 100 times every day, and every time they fall, they say, oh, I want to do it again. And they try, and we are more used to when we fall to say, oh, it's so horrible, I'm the only one who cannot walk, and I will never learn it, and everything will be very difficult, and then we're not going to achieve our goals. Yeah. So children are very good examples to learn to train in a very effective way.
So it's the change of beliefs that is the essence. Yeah. And it's by becoming proactive in your own healing process, which turns then around. And that's what you instigate by means of hyperthermia, so that it awakens all your buried emotions. Yeah. And then in the end, with consultations, you help patients to take charge of their life.
It awakens the body to be more active. It awakens the soul to be more active. It awakens the mind to be more active. So you have to take total responsibility for your body, for your life, for your spiritual side. So that's the basic to activate everything in yourself.